Okay, what about the heart and obesity? We talked about headaches and obesity. We talked about osteoarthritis and joint pains and obesity. We could talk about high blood pressure, sleep apnea. But what about the heart? Well, the heart basically gets stressed by the weight like the other organ systems. It's bothered by the fact that you're carrying around this extra weight. So that what happens is it responds to that with a stress response. So if I told you that I was going to scare you, you wouldn't be surprised if your heart rate went up when you got frightened. If I was going to hurt you, cause pain, you wouldn't be surprised if your heart rate went up in response to the stress of pain. If you were angry, the stress of the anger could cause your heart rate to go up. Okay? So for all those things we see, we know that stress can stimulate the heart to pump more, to pump faster. And as what happens is the body releases various stress hormones like adrenaline. They go to the heart and they cause it to pump more. It's part of the stress response. If you think about it in what's called teleologic terms, explanation why it would do that, maybe when we were cavemen and the saber-toothed tiger would come into the camp, the adrenaline would come into us and then we would be able to fight the saber-toothed tiger, to fight off the danger. So it's part of what we call the stress response. Well, obesity causes the stress response to be activated. It stimulates the release, and tachycardia is the first step of deterioration of the heart. First, a good healthy heart has a slow, powerful beat that can handle everything. So a marathon runner sits around a pulse rate of 40. As you get more illness and more heart dysfunction, the heart starts to beat faster, and then it gets very fast, and then it becomes irregular. The irregularity comes because it can only go so fast. If I tell you, for example, clap, 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 after you get certain speed, you can't do it in a coordinated fashion. And so what happens then, it begins to be irregular.
Does that explain flutters?
Yes, then on its way to flutter, and what are called some special kinds of fast, irregular heartbeats are atrial fibrillation, atrial flutter, paroxysmal atrial tachycardia, and things like that. And so your tachycardia, fast heart rate, is on the route to the abnormalities that go along with obesity, and those are these atrial and ventricular abnormalities and abnormal arrhythmias or irregular heartbeats. And so this is a step on the route of a heart that's not healthy and not doing well, and that's why your trainer appropriately decided not to train you anymore. Because with a little bit of additional stress plus your tachycardia, you could have a catastrophic arrhythmia such that suddenly you could pass out and die. And so it's another kind of warning sign that obesity by itself isn't healthy. That obesity begins to affect us by raising blood pressure, by raising cholesterol, by causing heart attacks, by causing sleep apnea and other abnormalities. And one of the things that can be deadly is it can affect the heart. And tachycardia is a step on the way to more serious arrhythmias like atrial fibrillation, atrial flutter, paroxysmal atrial tachycardia, ventricular tachycardias, and PVCs.
What's the percentage of your patients that have seen an improvement in their tachycardia?
All of them.
All of them?
Yeah. Yeah. So, again, let's do it this way. Normal heart, tachycardia, atrial flutter, PAT, atrial fibrillation is way over to the extreme. You may have seen the video on Gil Gerard, the TV star. Gil Gerard had atrial fibrillation with his morbid obesity. After his surgery, a year later, his doctor shocked his heart, and his heart atrium had shrunk back to normal size, and he no longer has atrial fibrillation. And we would expect that in your case, your heart's atrium will decrease in size, your heart will pump better, and your normal heart rate will drop 20 to 30 points.
Does that explain why my exercising program was always a flop? Because they tell you to get in a target zone.
Right.
And I would bypass the target zone in 10 minutes and above.
Right. In other words, your heart couldn't handle the stress. We'd like to, like for example, I would like to play NFL football. I don't have it. I don't got the body, the strength, the willpower, intelligence. I can't do it. Okay, your heart can't do that because it's ill. Now, You might not want that, but your heart is not doing well. That tachycardia is a sign that with a little bit of stress, it starts to fall over into the pathological abnormalities that allow it, that block it from trying to do stress so that the rest of your muscles can build.
So what you're saying, bear with me, repeat yourself. I'm just trying to get it to sink in. What you're saying is I could very well get off my toprol.
We expect that, yeah. We expect you're going to get off your toprol. You're going to be like Gil Gerard. Gil Gerard had much worse heart disease than you, much worse of an arrhythmia than you. You have an arrhythmia, it's junior. His was serious. He was on a blood thinner called Coumadin, which is rat poison. It's really dangerous, but they had to give it because he had serious arrhythmia. Yours is kid stuff. On the other hand, it goes down in this direction, and far in that direction is death. But you're here, and we expect that to get better and the toprol to go away.